Does constraint therapy work for the lower limb?
That's a good question. People have defined that in different ways. And the literal way is try to make someone use their weaker leg by doing some limiting motion of certain joints of the better leg. Well, that's
it's a little challenging for us being bipedal, right?
That might work in isolation if you're trying to get someone just in a sitting or semi-standing position, not to use their better leg, but to try to go through the motions of cycling or movement under those circumstances. But in real, we call reciprocal movement, you're actually moving one limb and the other. You can imagine if we try to restrain or constrain the entire good limb, it's going to change your posture so much that's going to make the ability to walk more effectively compromised. However, one of the emerging ideas, if you can follow me on this, which is not quite constraint, but it's an opportunity to try to change the signals that go between the brain and the legs. If you can picture someone on a treadmill, and I suspect many of you have been on treadmills or have seen them, but not your typical treadmill, a treadmill that has two treads on it. That is,
two treadmill belts that can be independently operated.
Two separate belts, 1 foot on each belt, and the speed of each of those two belts can be controlled independently. You know, we are very reluctant much of the time to spend time on our impaired leg. We want to spend as much time on the better leg as possible. So can you imagine, it's not constraint as we envision it, but can you imagine being on a treadmill so that the tread under your weaker leg moves slower than the tread under your better leg, which means you would have to spend more time on your weaker leg than you spend right now. And that can help change the rhythm of your movement and potentially improve your gait. So once again,